In 2011, Joan Nabasiri contracted an infection under her foot, something she did not think would turn out so serious.
I thought it's a minor wound, that it can be healed. I had to go in a certain clinic for treatment and daily dressing. And while taking some medicine, because I was on medication.
A year later, there was no sign of healing and it had become septic.
Then we had to go to Mulago Hospital. Reaching to Mulago, there was a certain doctor who sent us to come here, as in who admitted us to Kosu. I went for an x-ray. They told me to prepare for an operation because the wound was totally rot.
When she visited the hospital for review, Nabasiri was informed that she was suffering from osteomyelitis, and this time round her leg had to be amputated.
That infection affects the bones. So I got here 10 operations, and the 10th one was, it was when they told me that they are going to cut off my leg. I got scared and I told my parents that I'm not ready for this operation. I can't just come and they cut off my leg.
The procedure was done at Kosu Hospital in Chisubi, one of the few facilities that offer physical medicine and rehabilitation. Nabasiri says she was cancelled and later came to terms with the fact that losing her leg was the only best option for her.
Some social workers from here called me and they started counseling me about the advantages of cutting off my leg and the disadvantages. For me to decide, because I was totally not accepting what the doctors had told me. I was schooling, but at that time, the leg was rot up to the extent of not even moving on my own. I felt like I'm going to die. So I told my parents to bring me back here. I accepted.
Dr. Moses Nsubuga, an orthopedic surgeon at Kosu Hospital, explains that amputation, if recommended, is normally for the best of the patient.
We amputate a limb when it's dead, deadly, or a damn nuisance. It can be as small as a toe or a finger, okay? And then it progressively goes upwards depending on where the problem is, okay, and what the goal of the amputation is. Patients come, it's still deadly, but the cancer has spread everywhere. Now the limb is 3 times its normal size. It's both deadly because it's got cancer, but now it's also a damn nuisance because it can't move it around, okay, in which case it's got to go.
He says a patient who is meant to undergo an amputation will be counseled along with their family or partner because it is important for their healing process.
There are social issues, there are psychological issues. People need time to adjust. Sometimes they need their entire families around them, okay? They need lifestyle changes, okay? Imagine somebody whose business is roofing, okay? And then you're going to cut off their leg because they're involved in a motorcycle accident. He has to completely change the way he thinks so as to be able to earn a living after that.
As populations age and the prevalence of non-communicable diseases and injuries increases and the demand for rehabilitation grows, strengthening rehabilitation in health systems becomes ever more paramount.
What we see mostly here is trauma. Okay, motor vehicle accidents account for a significant amount of the amputations that we do. There are infections, okay, gangrene, and then we also do quite a number of amputations in diabetics because long-term the diabetes ages the blood vessels, okay. Ultimately, they get completely blocked and the tissues start dying off. There are a few children where that are born with deficiencies, okay, limb deficiencies, and the best way of managing those deficiencies is amputating, and then we fit them with an artificial limb.
When Naba City finally made up her mind in 2017, she was amputated and given an artificial limb, which she has learned how to use.
I'm used. I can even wear the open shoes. I even got friends who are normal people without disability, because even the institute I go to, I'm the only one with this. No one is like me.
Responding to the needs of people affected can be challenging in settings with limited health and rehabilitation infrastructure where many emergencies occur. Kosu Hospital makes the assistive devices and artificial limbs for its patients. The volume of traumatic injuries and the increase of chronic medical conditions that can arise in emergencies place considerable demands on the rehabilitation infrastructure of a country and can leave a legacy of disability for years to come. Walter Mwesije, NTV.